Hi, I'm Dr. Tabari, and today I'm here to talk about anesthesia or sedation that's performed in an oral surgery or dental office. Now, for a lot of people, anesthesia and sedation is a confusing term. For instance, you might have a friend say, well, I was at the dental office and I got sedated through an IV. And then yet another friend say, oh, I was at the dental office and I got sedated with pills. And yet you have some people saying, well, I was at the oral surgery office and I was sedated, but I remember being awake for part of the treatment. And you might have still others saying, why was my dentist sedating me? Okay, well, let's first start by defining some terms. Sedation is any kind of decrease in irritability or agitation via using sedative drugs. Anesthesia is defined as the temporary loss of sensation or consciousness involving analgesia, which is relief from pain, paralysis, unconsciousness, and amnesia. So now let's go through a make-believe scenario. Let's say we have a patient. We'll name the patient Benny. Benny has a wisdom tooth that's hurting him. So he goes to the oral surgeon. The oral surgeon tells Benny that he could take the wisdom tooth out under local anesthesia. What that means is essentially the oral surgeon will numb Benny up locally in the area and do the procedure. Benny shouldn't have pain, but he might still feel pressure, pulling, tugging. He'll hear popping, cracking, and probably hear the sound of a drill. Well, Benny says, I can't do that. I'm a big baby and I need more. So the oral surgeon offers nitrous oxide to Benny. Nitrous oxide is also referred to as laughing gas. But Benny says, I'm sorry, I need more than laughing gas because nitrous oxide might get your anxiety a little bit lower and it might help a little bit with pain. Nitrous oxide essentially takes some of the edge off. It's like having a couple shots of tequila. However, Benny wants more. And now we're going to talk about sedation. And what's important here is that we talk about levels of sedation. We will start off with the first level, which is minimal sedation. Now here, the patient has a little bit of cognitive and physical impairment. However, the patient still responds to a verbal command and the airway and breathing are still intact. The patient goes a little deeper and they're at the second stage, which is moderate sedation, otherwise known as conscious sedation. Here again, the patient is losing a little bit more consciousness. However, they still respond to harsh verbal command and tactile stimulation. Their airway and their breathing are still intact. We get further along in this levels of sedation. We have deep sedation. Here again, more loss of consciousness. And now the patient is not responding to verbal command, but the patient does respond to pain. Okay? And for the patient to keep his airway and breathing still intact, they might need some assistance from the doctor. Now, this assistance could be handled by a variety of equipment and a variety of techniques. And then when we go deeper, we arrive at general anesthesia. And this is the level where the patient is not arousable even by pain. Basically, the patient is out. At this level, airway and breathing are impaired, and adjuncts need to be given to the patient to help them breathe. For instance, if the patient loses their airway, they may need to be intubated, and that is done with this device, which is a Mac blade. And then this device, an endotracheal tube, gets inserted into the trachea to help them breathe. Alternatively, another device could be used, and that's this device. This weird looking thing is called a laryngeal mask airway. And it started being sold in the hospitals in the early 90s. It was developed by a guy named Dr. Brain. And no, I'm not making that up. That is his real name. Now what this device does, it creates a seal between your oropharynx and the trachea, so the trachea does not have to be penetrated. Thus, it's a less invasive procedure. So typically, the level of sedation that is desired in an oral surgery or dental surgery outpatient procedure is this level, from here to about here. At this level, the patient is comfortable enough that the surgery is not bothering them, yet they're not deep enough that they need airway adjuncts to help them breathe. But it's important to note that these levels are a continuum, meaning that the patient could go in and out of one state in a continuous fashion. They're not stuck at a state for too long. And that is the fundamental difference between oral medications and IV sedations to achieve anesthesia. With oral medications, the patient obviously takes the pills, and then it takes about 20 to 30 minutes for the pills to absorb through the GI system and have their effects. However, with IV sedation, the effects are much quicker because the drugs are directly going into the venous system, and the drugs don't last as long. So it's basically in and out. So what that means is that with IV sedation, the drugs are titratable, meaning the doctor can adjust the levels very quickly. Whereas with pills, let's say if the amount is not enough and the patient is still awake, it's hard for the doctor to adjust that because it takes 20 to 30 minutes for it to go through the system and have their effects. Also, if the doctor needs to reverse any agents with reversal medications, they could do it very easily through the IV, whereas it's not so easy with oral medication. And usually the effects of oral medicines last longer. So when we use pills, we're trying to essentially get this level of sedation. And when we use IV medications, we're a little bit more liberal, and we're trying to get at this level of sedation. We can be a little bit more liberal because we have more control over the sedation through the IV. So in summary, if you get oral medications for sedation, you'll probably be comfortable, sleepy, and you probably won't know what's going on. If you get IV sedations, you'll probably be in a deeper level of sedation based on what the doctor gives you for drugs, and you will pretty much be out. And now for the final question, why is my dentist sedating me? Well, some general dentists and dental specialists take advanced courses and have to witness a certain number of cases to be able to be given moderate sedation. Oral and maxillofacial surgeons do about 4 to 6 months of resident training in the hospital with the anesthesiology team, and they are trained to pretty much give general anesthesia. Moreover, some dentists and oral surgeons may have an anesthesiologist in their office to do the sedation while they themselves perform the treatment. Well, I hope that this answered some of your questions about sedation and anesthesia in an outpatient oral surgery or dental clinic. It should be noted that a consultation with the surgeon and or anesthesiologist is warranted before the procedure. And just remember, don't just let anyone take your breath away.